morning.
Good morning.
A Tale of Two Cities. It was the worst of times, it was the best of times. The tale begins in 1607. Entering the Union, the 10th state of the United States is Virginia. The setting is two cities, Richmond, the capital of Virginia, and Petersburg, the city 23 miles south. It was the best of times back then because of the abundance of agriculture, cotton, and tobacco in agriculture, and the worst of times because of the Revolutionary and Civil Wars, in which Native Americans and Black Americans had very little say about what was going on. It's the best of times today because this metropolitan area of Richmond, Petersburg, and the surrounding counties consists of an area of 1.2 million people and has now become the fourth most populated area in the state. Blacks make up over 50% of the populations in both areas, yet they also have lower median incomes and higher poverty rates than the whole entire state of Virginia. It's the worst of times because, again, Blacks, African Americans, have a disproportionate burden of HIV. As recently as 2013, Petersburg, which is a city of about 23,000 people, south of Richmond, 23 miles south, is now #1 for new HIV cases in the state of Virginia. Richmond in 2013 ranked #2 for new HIV infections. And one of these neighboring counties that bumps Petersburg, Brunswick County, is now rated #3. The target population was the African American community, specifically young Black MSM community. And it's been the worst of times because this population was chosen because of the community profile and the epidemiological data in our needs assessment show that the burden of HIV and STIs has impacted heavily on the African American and the young Black MSM community. Social factors such as socioeconomic status, inequality, poor social support systems, insufficient health care and treatment services, and limited knowledge in the community significantly increased the incidence of new HIV cases. Yet, it's the best of times because we anticipate that with the launch of BTAN and our strategic and efficient expansion of services, we will cover these gaps and reduce the new HIV transmissions. Out of our gap analysis, we took a look at some of the strengths in the system weaknesses, opportunities, and threats. Some of the strengths are that Richmond has a limited amount of resources, but it has a large capacity of agencies that house HIV prevention services and educational services. There's opportunities for people to work together, but some of the threats are that existing agencies sometimes work in a vacuum, and there's a little territorialism that exists within the Richmond culture. So we're experiencing the worst of times because there's an absence of a collaboration with young MSMs in the community, and also there's insufficient information regarding the importance of confidentiality that's disseminated throughout the provider community. Yet it's still going to be the best of times because we've been invited into the conversation with the target population who have expressed that they want services that are confidential and delivered in an environment of respect and acceptance. In comes the BTAN Treatment Advocates Network. We continue to experience the best of times in the creation of the BTAN Black Treatment Advocates Network in Richmond, Petersburg, because BTAN will address the community's need through training and mobilization. And when people understand the science of HIV and AIDS, they're less likely to participate in stigmatizing behaviors and they're more likely to access treatment. They're better able to adhere to their regimens and better positioned to influence HIV/AIDS policy. Some of our existing locations of BTAN is Los Angeles County, Virginia, Chicago, Illinois, and this year we welcome Little Rock, Arkansas, and Kingston, Jamaica, among a few other cities. A total of about 23 cities that will be hosting BTANs across this great country. The best of times, because we have a plan for BTAN project areas: treatment education, patient navigation, disclosure, and advocacy. Treatment education will help to educate persons about the importance of adherence to medicines and the signs and treatment, information about how the medicines work. Patient navigation will help to increase linkages to care, access to care, and retention in care for persons who are found to be HIV positive through testing and recruitment programs. Disclosure will help to make it more comfortable for persons who may be living with the HIV virus on deciding when, who, and how to tell someone that you're living with HIV, to help to reduce the stigma and to increase access to care. And advocacy will help to educate the community to better be able to speak up and to participate in decision-making and policies that help to run this great country in regards to HIV science and treatment. The mission of BTAN, which you see over here on the left, is to produce and support a nationwide network of highly trained Black treatment advocates who will serve as educators and opinion leaders in our communities, provide a pipeline of trained Black African Americans for community advisory boards, facilitate expanded African American participation in clinical trials, and also to increase utilization of early treatment. Our BTAN logic model sort of shows exactly how it works. In order to get these desired impacts, we look back to the objectives. An example, to serve as educators and opinion leaders within the community. Some of the activities that will go into that would be the implementation of the 4 project areas: advocacy, disclosure, patient navigation, treatment education. And output would be to create, all 23 cities would be to create a total of 200 treatment education sessions across the nation, which would intend to increase the science and treatment literacy of the Black HIV/AIDS workforce and increase the number of Blacks who reach viral suppression, which the total impact would be to increase viral suppression among people living with HIV in our impacted communities, and to decrease viral load in Black communities and increase participation of Blacks in clinical trials. Some of our partnerships include local health departments, pharma companies, faith-based organizations, HIV/AIDS resource centers, Petersburg Community Health. We have so many partners, we did not put them all on this slide. But the new members who were recruited for participation in our BTAN were recruited because they lived in the area, Richmond and Petersburg, that was impacted and wanted to be a part of the solution to improve the conditions. Unforeseen opportunities during our internship included scheduling meeting training days and times convenient for members. So many people work for other agencies or do things in the community during the workday. It was difficult to find a meeting date and a schedule that would fit everyone's schedule, so we did the best we could, and those that were able to participate were there, and those who may not have been able to be there physically deployed assets and resources to help us to be able to get through the steps of the internship. The best of the times continues with the partnerships with traditional Black institutions such as Virginia State University, Virginia Union University. We wanted partners from faith, HBCU, civil rights, the AIDS Education Training Center, health departments to ensure BTAN's viability, eliminate the worst of times in this area in which the sectors do not want to work together and make use of the diverse skills and resources of all people. It's the best of times now because we are a triple threat. One, because we have a history of working with many of these partners. Two, we have a successful, proven track record in the community. And three, most of all of our partners have a history of working in the field of HIV. So our successes include having dedicated partners in order to help us deal with the problem in our community, which brings us to the worst of times. In the cities of Richmond and Petersburg, young black MSM account for over 64% of the new HIV cases, 79% between the ages of 13 and 29. Our goal would be to assist them in suppressing the viral load within these populations. We will accomplish that by prevention services delivered by peers such as the persons you see in this video, in this photograph here. We have young MSMs, transgender, African American women, African American men, who will use non-traditional approaches, which will include collaboration with young black MSM and other organizations familiar with youth serving population. Okay. In order to get to the level of dealing with the problem, we first had to attend the Black AIDS Institute Treatment Learning Boot Camp here at UCLA on last year. From the information that we learned, we had to go back into our communities and we had to train our staff to disseminate the information that we had learned, because in order to deal with the problems in our community and to be ready to go into the battlefield, to make it the best of times, we had to train our staff. So here you see one of our one-day training sessions. In this particular picture, they were learning about the innate versus acquired immunity, cells and organs of the immune system, how it works. And you see them, I think this is some of them that participated in that workshop. And one-day training. We also talked about natural history, the human immune system, HIV structure. Initially, these concepts were a little difficult for us during the 30-day boot camp, but by the end of the 30 days, we decided to study them a little further and to go back into our communities and teach our staff so that they communicate to laypersons. Who presented this information to our staff in the community? Lindsay and I. We had approximately 13 participants, and the pre and post test results showed an increase of 63% increase on the post test over the pre-test. Our evaluations that we received feedback, we scored a 4.6 out of a 5 with an average to excellent comments. Some of the successes and challenges is that other people were invited to the training, but due to work and academic schedules, they were not able to attend. This tale of two cities continues to model the best of times, because a newly established BTAN, as a newly established BTAN, we have developed goals and strategies for recruitment of our BTAN members. We became educated, as I said earlier, via the AAHU Science and Treatment College here at UCLA. We've collaborated with TBIs, community and public officials to communicate the mission, the goals throughout our training. We also held a 3-day BTAN Science and Treatment class, and you'll see here many of the people who participated. We had representatives there from historical black colleges. This lady here is the director of the Virginia League of Planned Parenthood, education director. We had people from the AIDS Training Center. We had Rebecca Israel there from representing the BTAN Black AIDS Institute staff and our technical advisor. Some of the topics during the 3-day treatment training was natural history of HIV, the human immune system, the origins of HIV, HIV structure and life cycle, major basic science discoveries. Again, we had Lindsay was there, and we had many very cultural and competent speakers. some of the successes and challenges were that, again, some people were not able to attend because of the scheduling differences. We also had our district director of the Richmond Health Department, Deputy Director Dr. Daniel Lula was there. We also had one of our instructors here from the 30-day boot camp, which is Dr. Derek Butler, who was the director of the Helping Everybody clinic here in Los Angeles. He came in, he was able to do a presentation for the VTAN training in the morning, and that night we were working in collaboration with the AIDS Education Training Center director and working through one of the groups that was sponsored through Gilead Sciences. We were able to host a dinner for a lot of the healthcare providers who work with patients with HIV, and they had a chance to meet Dr. Butler, and he gave a very culturally competent presentation that night. Some of the challenges over the 3-day training was, there were challenges, but they were minor. Mostly it was like parking, dealing with parking fees, the issues, getting participants to be able to balance their work schedule. Some people had jobs that they couldn't stay away from for 3 days, so that became a challenge. But all in all, over the 3-day period, we were able to have 83 participants over a 3-day period, and they were very engaged and enlightened. And so Lindsay, my co-chair, will now continue to tell with the next steps.
Thank you, Juan. The plot thickens. Our project plan, VTAN Petersburg Richmond, is experiencing, as Juan said, a period of the worst of times. Our problem statement states that in the cities of Richmond and Petersburg, young black MSM account for 64.4% of new HIV cases. And of that, 79% are in the age range of 13 to 29. Our goal is to assist in suppressing the viral load within these populations. And we will accomplish that goal by our prevention services being delivered by peers, far more effective with their service delivery if you have peers facilitating the training. Also, we will use non-traditional approaches by collaborating with Young Black MSM and other organizations that are familiar with working with and serving youth between 13 and 29. Our next approach is our treatment education of part 1 of the project plan. And with that treatment education, this tale of 2 cities goes forward that within the next 6 months, we will conduct a treatment learning camp for 20 African Americans, which will include our target population of young black MSM. And the purpose of that is to increase the science and treatment literacy. Our next step in our project areas is patient navigation. We will conduct 3 HIV testing events and linkage to care within the next 6 months. That target population will be African Americans, and we want to get 150 African Americans in that, which includes high-risk heterosexuals and young black MSN, again, our target population. Thirdly, disclosure. We will establish a speakers bureau. We will train and deploy for HIV positive people living with AIDS. The result of that deployment is that we will heighten community interest and knowledge of HIV science and treatment. And also with those project areas, advocacy is so very important. We will, in this area, conduct an Affordable Care Act forum. That forum is going to be focused on the Affordable Care Act, which will increase the knowledge of that act as well as the enrollment processes. These target areas will result in our VTAN Richmond project plan. This plan will align our needs assessment findings as well as take into account of us listening to our target audience, which outlined to us that they wanted to avoid stigmatization of the target population by exclusively having young Black MSM, but we wanted to include Black African Americans within that target population. And we took that information into account and changed our problem statement to also include the heterosexual African American population. Monitoring. So we've laid out our plan. We've told you some things that were the best of times and the worst of times. So how are you going to put all that together and see that you get results? We will monitor our progress a number of ways. One way, we're going to follow the measurement tools that we set up on our action plan. We're going to continue with the open dialogue that the committee members and participants have to ensure that they know their voices are heard and acted upon. We're going to keep our focus on the problem statement. And thus far, with those things, we have been successful. Resources, including in the best of times, because you always need resources. You can have a plan, but if you don't have somebody to fund that plan, it's not good. It's not a good plan. So that includes our BTAN partners who have been and who continue to let us know that they have venues available for us to use at no charge. They provide refreshments in that, materials and people resources by letting us have access to interns that are in some of our colleges and universities in Richmond and Petersburg. Our successes, and we do have some successes. Once again, to mention what Juan mentioned, some of the venues that we have are in our downtown Richmond area, and so parking does become a situation, something that we need to overcome, as well as when we have trainings and meetings to ensure that there are times when the majority of people can be there, and then a follow-up with those who cannot be there as far as the minutes and notes or follow-up phone call conversations to let them know where we are and what our next steps are. But again, the best of times, we're going to celebrate that. We had 83 that attended over the 3-day period of our BTAN training. And with that, we had over 20 culturally competent facilitators, the best. Our successes continue in our facilitators that we had in our 3-day training and who continually support us. As Juan mentioned, Dr. Derek Butler was there. He's director of the Help Everyone Clinic. Rebecca, who's sitting here, flew into Richmond and assisted us with the Black AIDS Institute. And then one of our pastors, campus pastor in Petersburg, Virginia, Reverend Maceo Freeman. He's the pastor in one of our BTAN cities. Continuing with our successes and challenges, we are in collaboration with the NAACP, our fraternities and sororities. So we have membership with Phi Beta Sigma fraternity and Zeta Phi Beta sorority, and they continue to support us and encourage us. In conclusion, this tale of two cities, Richmond and Petersburg, our next steps are to sustain BTAN Richmond-Petersburg, including implementation and evaluation continually of the BTAN project areas. We will continue to build the core group, identify individuals ready to work in the groups, identify individuals who can commit to and attend the meetings, increase the number of contacts with the young Black MSM and organizations that serve them. We will continue to identify and invite key stakeholders. We will continue to recruit potential members. We will continue to build our community coalition and with meetings. We will continue to follow up and follow through. We also will continue to collaborate with national and state faith institutions. Juan and I have made a personal commitment that we will increase our leadership through continued education. I know I've signed up for a DEP training that's coming up in Richmond in August. We will continue attending the webinars and increasing our collaboration with social institutions. We're going to use existing relationships that we have to create new relationships so that we can have as many people as possible, many voices as possible, to get the information out to the Black community. Our recommendation for future training and advocacy in our community include connecting with the African American faith community, both on a national and local and state level, extending outreach to young Black MSM, extending outreach to the Black media, extending outreach to NAACP, as well as local and state leaders, talking about the best. As part of our outreach to those leaders, Juan here was in a radio interview with one of our Black media in Richmond, and also with the lady that's in charge of the NAACP. So those are some of our continued partners at our traditional Black institutions. So now, our network, our fellows, our people, those of you sitting in this, are you like that? Those of you sitting in this room, our BTANs, class of 2013, the best of times begins when? Right now, today, with this symposium in this room, the room down the hall, and how far it goes to other rooms we don't even know about yet. But we have that power, we have that ability to take it forward. One of the things that we're doing, beginning on Monday, July the 17th, is to launch with one of our BTAN partners in Petersburg, Virginia, the first ever men's sexual clinic in the history of Petersburg. They're going to have nighttime hours. This is for men only, no stigma, full treatment and testing for HIV and STDs, talking about the best. As Phil Wilson, CEO and founder of the Black AIDS Institute, in his response to how close we are to an end game, and his response was, this is a deciding moment. Will we use these tools? Will we do our part? And when we do our part, there is nothing, not anything, that we are not greater than. Together, 2013 AAHU Fellows, our BTAN supporters in this room, UCLA and his son, Black AIDS Institute staff, our world, together, we all are greater than AIDS. And together, we are experiencing not the worst of times, but we are experiencing the best of times. And for that, we say thank you.